Hello, and welcome to the Infant Development Clinic, also known as NICU Follow-up Clinic. The clinic is part of the Providence Children's Development Institute, or PCDI, and is located on the hospital campus. PCDI provides support to infants who are at risk for delays in development, growth, or feeding due to premature birth or other medical concerns. When you come to PCDI, you will see some new providers and some familiar faces from the NICU therapy team. Your first appointments at PCDI after NICU discharge will be scheduled before you leave the NICU. We recommend early follow-up because we know that babies who receive early support do best in the long run. Without appropriate follow-up, there is a higher risk of delays that could have an impact on your child later in life. There are several different types of specialists available at the clinic. Your baby will be scheduled based on their individual needs and may see some or all of the following providers. Developmental pediatricians and nurse practitioners are medical professionals with training and experience in diagnosing and treating developmental problems. Physical therapists assess gross motor skills, such as rolling, sitting, or crawling. They may help with other areas of development as well, such as feeding or play. Occupational therapists evaluate and offer suggestions to improve infants' movement, sensory processing, state regulation, and play skills. Speech-language pathologists help infants to learn to eat properly and communicate effectively. Registered dietitians are experts in nutrition who will make sure your infant is growing properly and getting the nutrients that they need for their health. Other services offered at PCDI include social workers, who offer support to families in need of assistance, psychologists, who conduct comprehensive diagnostic evaluations of children with known or suspected developmental or behavioral disorders, audiologists, who evaluate infants' hearing and treat hearing loss. What can families expect at their first follow-up appointment? The first visit occurs 2 to 3 weeks after discharge from the NICU, and may include visits with a dietitian, nurse practitioner, and/or a feeding therapist. Your baby will be weighed and measured, and feeding and movement will be observed. The team will take a thorough history of what and how much your baby has been eating. Parents will be provided with recommendations to support baby's growth and development. When the baby is 3 months corrected gestational age, the first full team assessment with RD, PT, and MD or NP will occur. During this assessment, the team will undress the baby to their diaper in order to assess their movements. Your baby may be videotaped during this time to allow PT time to review movements more closely. They will also complete a standardized motor assessment, which measures motor skills as well as cognitive development. They will use a few toys and watch your baby's response. They will also watch your baby move in certain positions to better understand your baby's development. The dietitian's role will be similar to the first visit. The doctor or nurse practitioner will review the baby's history, discuss the baby's current status, and answer questions about what to expect regarding development in the future. Your baby's growth and development will be assessed, and you will be provided updated recommendations to support your baby's growth and development. PCDI is located in the East Medical Tower on the St. Vincent campus. Valet services are available on the bottom floor of the East parking structure, across from the roundabout in front of the East Pavilion. Self-parking in the parking garage is also available, but the garage can often be busy, so consider leaving a few minutes early to allow time for parking if you are planning to self-park. We also provide drop-in childcare at My Little Waiting Room. This service is available to siblings of patients and is located inside Providence St. Vincent Medical Center at the East Pavilion entrance. Reservations are recommended and can be secured on a repeat basis to allow you to attend appointments with just your baby. My Little Waiting Room is currently closed due to COVID, but will reopen soon. Swindell's Resource Center is located inside PCDI and offers services at little or no cost. Services include care notebooks, an infant's personal health record, speakers and community education events, resource library for caregivers, parenting resource groups, support and referral services. In general, your baby will continue to be seen until the age of 2 years. The developmental team will recommend follow-up appointments and community service referrals based on your infant's individual needs. Please talk to your medical care team about making your developmental follow-up appointments. Thank you for your time, and we look forward to seeing you at PCDI.